And now I'd like to introduce broker with the Barend Agency, Mr. Len Barend.
Thank you, Janet, and thank the Chamber very much for this opportunity. I really appreciate it. As a member, this is a nice way to communicate with other members. What we're going to do is discuss Medicare, but before we do, there's some questions that need to be asked on your end. Are you going to continue to work? If you are, do you have more than 20 employees or less than 20? If you have less than 20 employees, you must sign up for Medicare Parts A and B. Otherwise, you will be penalized down the road when you do apply for the rest of your life. If you have over 20 employees in the company, you do not need to sign up for Medicare Parts A and B, but just sign up for Part A only, which is hospitalization. The reason for that is that Medicare looks at employers with more than 20 employees, and the group plan pays first and Medicare pays second. Less than 20 employees, it's reversed, and Medicare pays first. That's why you have to have both Parts A and B. But let's look at what Medicare is all about. There are really four parts. Part A is hospitalization. Most Americans have more than 10 years of work, so that is given to them at no cost. Think about it. You've been paying for this your entire life as part of your Social Security taxes. So if you have over 10 years of work in the United States, Medicare Part A is free to you. If you have between 7 and 10 years, you can buy it for $227 a month. If you have less than 7 years, you can buy it for $413 a month. Part B is everything outpatient. Most Americans who are already on Medicare Part B are paying about $110 a month. If you're aging into Medicare in 2017 or currently on Medicare but not collecting Social Security, that Part B premium is $134 a month. Additionally, there are surcharges added for people who are single and making more than $85,000 and married couples filing jointly who are making more than $170,000. I'd be more than happy to field those questions today or at another time if you need to know more about that. Part D is drugs, and it varies by plan. There are 23 plans in Clark County. Part C is A, B, and D, but from private insurance companies. Let's talk a minute about how to sign up for Medicare. You can sign up for Medicare 3 months before, the month of, and 3 months after your 65th birthday. All you need to do is 3 ways. 1, go to the National Social Security hotline number, which is 800-772-1213. You can go to the nearest Social Security office, and there are 3 of them in Southern Nevada. One is on Rancho in Charleston, one is on Eastern Avenue in Henderson, and the other one is on Simmons Street in North Las Vegas. But there really is an easier way, and that's to go to the Social Security website, and it's www.ssa.gov/Medicare. Once on the site, go to the bottom of the page and click the button Apply for Medicare Only and follow the process. Please remember, you're applying for Medicare only, and it has nothing to do with Social Security. Social Security controls the enrollment of Medicare, but that's it. Medicare is at age 65 unless you are disabled and the other rules apply. Since Social Security and Medicare are separate, when to apply for Social Security is a question to ask your financial planner. Now let's look at what original Medicare is. And original Medicare is Parts A and B in a separate drug plan. As we've already stated, Part A is hospital, Part B is everything else, and you must have a drug plan to go along with that, even if you are not taking any medications. Because again, if you don't take the drug plan when you were supposed to, Medicare will fine you 1% a month of the average premium nationwide for the rest of your life. Here are some pitfalls in having original Medicare in a drug plan. The good news is you can go to any doctor, any hospital, anywhere in the country. The bad news, there is no maximum out of pocket. So you're paying 20% of the bill forever. You have a $100,000 procedure, that's $20,000 out of your pocket. There's another piece, and it's called Medicare Assignment of Benefit. And it essentially means if the doctor, lab, x-ray, hospital, facility does not take Medicare Assignment of Benefits, means you, the recipient, has to bill Medicare directly. But it also means that that doctor facility can charge you the 15% that Medicare disallows. So let's look at a $100 doctor visit. Medicare says we're only going to pay $80, and they pay 80% of 80, which is $64. You're responsible for that $16 that Medicare didn't pay. And now you're also responsible for that $20 that Medicare disallowed because the doctor doesn't take assignment of benefits. Medicare Advantage is really Part C, and it comes in two flavors, vanilla and chocolate. Vanilla is the HMO and chocolate's the PPO. These plans also include prescription medications. These plans offer more than original Medicare. Some have silver sneakers, some have silver and fits, some offer dental vision and maybe even hearing benefits that you wouldn't normally get under original Medicare. There are 5 HMO plans and 4 PPO plans in Clark County. As again stated before, there are also 23 drug plans in Clark County. Looking at Medicare supplements, and supplement in English means in addition to. So in addition to your original Medicare, you buy a supplemental plan. There's some very important things to know about it. There are 10 plans that are available nationwide. The federal government controls what benefits are in each plan. The individual insurance carrier determines the price of that plan or the premium. So I could show you in Clark County where a Plan F, which is perhaps the most popular plan, I can show you a $100 swing in prices based on one carrier versus another. The plans are A, B, C, F, high deductible F, G, K, L, M, and N. In 2020, Plan C, F, and high F are going away. If you have these plans, you can keep them because they're guaranteed renewable as long as you pay the premium. Most popular plans are the F, the high deductible F, and the G. They do require that you have a separate drug plan. The drug portion of Medicare is probably the most complicated and convoluted part of all of Medicare, and it's really very difficult for most people to understand. There are 3 types of plans: a saver plan, a preferred, and an enhanced. The saver plan has a deductible. The premium varies by carrier, but the deductible is set by the federal government. For 2017, that deductible is $400 annually. Sometimes the deductible only applies to brand name drugs. Sometimes it only applies or applies to all drugs. Depends upon the plan. The preferred plans have a higher premium and typically don't have a deductible, but this is where a broker can really be of value to you. We will load those drugs into the Medicare.gov website, show all the 23 plans that are available, and looking at the plans in depth, determine which ones best fit your needs. Let's use me as an example. I happen to be on Medicare and I take 3 generic drugs. I have a deductible. So I was looking last year at a different plan that cost $7 more a month but didn't have a deductible. Well, when I dug deeper, I found that 2 of those 3 generic drugs were brand drugs on this particular plan, but on my plan, they were all generic. So the $400 deductible is really less expensive. And that's the depth that you must go to understand it. The problem with the drug plan is understanding the concept. And the concept is that there are 3 phases. Phase 1 allows you to spend $3,700 annually based on your copay and what your insurance company is paying for that drug. Once you've expended the $3,700, you fall into the donut hole or the gap, and then you are basically responsible for the next $4,950 in drug costs. However, if you have a generic drug that you paid $4 for and the insurance company paid $16, the real cost is $20. You will pay 51% of that $20, or roughly $11. On the brand name drugs, the drug that you're paying $25 for is really a $400 drug. You will pay 40% of that $400, or roughly $160. The drug company and the insurance company will pay the balance, but you get to count 95% of that $400 against the $4,950. And if that isn't confusing, I don't know what else is. That really is, someone who had to think that up had to really, how are you going to make Americans really think? Anyway, once you've passed the donut hole, you fall into catastrophic coverage, and you're roughly going to pay 5% of the cost of the drugs until January 1st of the following year, and it starts all over again. Now, the only good news on the drug side is that the government plans on getting rid of the donut hole by 2020, and I suspect that you're going to end up paying roughly about 25% of the cost of those drugs, but that hasn't been finally determined. But that's the general consensus at this point. At this point, I'm open to questions. I just gave you a very high-level overview of what Medicare is and isn't, and some of the pitfalls, and I'm more than willing to take questions at this point.
And again, if you'd like to ask a question, feel free to type it into the chat box in the bottom left corner of your screen, or to unmute your line, you can press *7 on your phone. Just a question, in 2017, is there anything happening in this year that has changed that employers need to know about?
Not really. I think the biggest thing is if you work for a company with over 20 employees and you're going to stay on the company health plan, do yourself a favor and go to your Human Resource Department and ask them to give you a credible drug letter. And you do that every year. So now you're 69 and you want to retire and you have no credible coverage drug letter. The first thing that Medicare is going to do when you sign up is send you a bill saying you didn't have credible coverage and therefore you're going to be fined X dollars per month for the rest of your life. And that number goes up as the average price of drug plans go up. So having that letter eliminates the problem. It's putting a belt and suspenders on to hold your pants up, but it's really a safe way to go.
And then on the Nevada legislature side, is there anything that is happening that you've heard of, any bills coming out that you think would affect Medicare in Nevada?
They really can't because Medicare is a nationwide program. So if anything's happening, it's going to happen at the federal level. Now, there's been some talk about what the government wants to do with Medicare, go to a voucher-type system. But at this point, it's all talk. I would rather wait and see what transpires before commenting, because all I'm giving you is, I'm from back east, and there's a term called swag, a silly wild-ass guess, excuse my French, but that's really what it is. And I thought I would just share that with you as a way of making a little joke.
Well, if there are no questions for today, I want to remind everyone that you can ask Len questions. His information is here on the screen right now, and if you think of any questions after the webinar has ended, feel free to shoot them over to the chamber, and we'll make sure that Len gets them so he can answer any and all of those questions. Again, this is being recorded, so feel free, if you need more information, you can re-watch this on our website at lvchamber.com. I want to thank you so much, Len, for sharing today, for being a part of Chamber University, and I want to remind everyone that to join us next week, where we're going to be talking with Legal Shield about some small business legal issues that you might have to face this year. So thank you guys again, and we'll see you next week.